Hey guys, welcome back. This is Dr. Jadhav, Densitae Hair Transplant Center. One of our viewers asked me one question. Doctor, is there any age for hair transplantation? So I just want to discuss this thing in a detail in today's video. So age, minimum age, and we can talk about a maximum age. Okay. So you know that baldness is now a major problem. And for the baldness, which is androgenetic, most of the times, the treatment of choice is hair transplantation. When you are completely bald, when there are no hair roots, nothing works, no medicines, no lasers, no PRP, nothing will work for you, then and then only you have to go for a hair transplantation. But what is the criteria? Whether at the age of 18, am I going to go for a hair transplantation? Or at the age of 75, I am okay with the hair transplantation. So question is, 18 is an appropriate age? We can say no. Why? Because that is the starting age of your baldness. So baldness has to be established. The hairline has to be established before you go for a hair transplantation. It means that whenever you have an active hair fall, you don't try to go for a hair transplantation, whatever the age will be. So we have started doing a hair transplantation according to the grade of baldness rather than according to the age. Because somebody, if it is bald at the age of 20, you cannot say no for the person because that is the age where you want to have more hair, you want to have a good look. So if you are denying that, that means you are doing something wrong for the patient. So we have started doing hair transplantation from the age of 20. There is no upper limit because if you have a good hair follicles, good donor area, there is no criteria when you can do hair transplantation. But definitely for the lower age or minimum age, you should try to wait till your hairline becomes stabilized or the hair baldness, you can see the baldness level becomes more than 3. So there are stages of baldness from grade 1 to grade 7. Do not go for hair transplantation with the grade 1 or grade 2 anytime. Grade 3 is what we have started recommending for everybody. There is no age criteria for that. So when you have a good hair donor area and grade is more than 3, you should try to go for hair transplantation. If it is grade 1 and grade 2, try to maintain your hair, good healthy hair with the help of medicine and other treatment modalities like PRP, lasers and meso hair therapy. So you must have understood what exactly we are targeting. We are targeting the grade of baldness. We are targeting the, you can say, amount of baldness, what it is, rather than age factor. If somebody is having good donor area, then age is not a factor. If some complications are there, might be some medical conditions, some like alopecia areata, some uncontrolled diabetes, or some convulsion patient, fit patient is not controlled. So these are other possibilities can be there when you have to consider your primary physician and then get fitness from him and then go for hair transplantation. Thank you for watching this video. Keep subscribing, keep watching. Till then, bye-bye.